Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be talking about Mepitel One. It's a silicone contact layer. But first, if you could hit the like and subscribe, it would be truly appreciated as it does help my channel grow. So let's get started. So Mepitel One, it's a truly great product. I really haven't found any other, there might be, but I haven't found any other contact layers um, just like this one. So it is a one-sided wound contact layer that does kind of conform to the body. So it does not leave any residue, it doesn't dry out, and it allows for the cover dressing to be changed as needed without disrupting the wound bed, okay? So it actually stays in place and you just take off the cover dressing, you can cleanse it and put another cover dressing back on. But it doesn't stick to the gloves or scissors. There's a very low potential for skin irritation or allergy to the product, and it can be left in place for up to 14 days as long as there's no signs and symptoms of infection. So indications for this product. So we are using this to protect a healing wound base from the secondary dressing. So it goes on the wound base. When you're pulling off a secondary dressing, sometimes some of the fresh healing tissue goes with it. So this stays on the actual wound itself and it protects from that secondary dressing when you go to take it off. It's great for painful wounds, and it may be used in conjunction with negative pressure wound therapy. Some precautions. Adhesion is slightly higher in patients who have epidermal lysis bullosa. So just be cautious with that if you're treating that. Adhesion level is slightly higher. If you're treating burns with mesh grafts or after a facial resurfacing, the imprint of the contact layer can occur. So you want to make sure that you don't have any unnecessary pressure on the dressing, and you're going to be repositioning this layer at least every 2 days, okay? So the layer can just be lifted up a little bit and moved, okay? So you don't get any little circles on that new tissue. If you're using for the fixation of skin grafts, you want to make sure that you're not changing this dressing or touching it for 5 days or as the surgeon's orders. Contraindications, we're not going to be using this with any sealants or barriers. So to apply the Mepitel, we're first going to start by cleansing the wound, just as in any other product. Clean with normal saline, and then just dry the peri-wound tissue. Now to apply, so the Mepitel, it does have one sticky side and one side that's not sticky. So you're going to remove the release film, okay, and that is going to be the tacky side, and you're going to put that on the wound, okay? So this can be cut to size. And you're going to apply an appropriate cover dressing over top of this to maintain your moisture balance, okay? So it does have little holes in it, so the exudate will flow through it nice and easily to that cover dressing. So to remove, you're just going to take off your cover dressing and then just gently lift up on the contact layer. So the expected outcome is that it doesn't actually stick to the wound. So if it is sticking, that's not something we want. We want the contact layer to just come off very nicely, which it should. Most of the time it does. So the frequency of the dressing change, it's all going to depend on the amount of exudate. So the Mepitel One can be left on for 14 days. You just have to reposition, like I said, for mesh graft or facial resurfacings or on burns, so it doesn't keep the imprint on them. And if you're using it for negative pressure wound therapy, you're just changing it every time you're changing the negative pressure wound therapy. So you would just change it every time. So it does come in different sheets. It can be cut, as you can see here down at the bottom. There's different sizes. And yes, it can be cut. So I did just want to add here that the Mepitel One, it does not have any antimicrobial properties. So we are using this on wounds that are not clinically infected. And that's all I have for this video. So I will catch you in my next one. If you haven't done so already, please do subscribe to my channel, as it does help my channel grow. I'll see you guys next time. Bye.